Good evening and welcome to our COVID-19 update. I am Ladi Akiridoluale. Here are the highlights at this hour. President Buhari is to spend Sallah at the villa, bars visitors owing to COVID-19. Federal government fixes dates for NECO and NAPTEP exams. And Muslim faithful based in Saudi Arabia begin annual Hajj pilgrimage. Outsiders are not allowed because of COVID-19. We'll begin from the nation's capital, where the presidency says President Muhammadu Buhari will observe the Eid al-Kabir prayers with his family at home on Friday. The statement explains that the decision is in line with advisories from the Nigerian Supreme Council for Islamic Affairs, as well as the Presidential Task Force on COVID-19. The president, in the statement, also reiterated that the protocols issued by the PTF states that large gatherings, as much as possible, should be discouraged, and where small groups choose to hold the Eid together, face masks are absolutely necessary, as is social distancing. The statement, signed by his special assistant on media, Malam Garba Shehu, also says that such prayers are to hold outdoors and worshippers are encouraged to bring their own prayer mats to stop the spread of COVID-19. The statement adds that the president will not be receiving Salah homage from religious, community, party, and government leaders, and asks all citizens to observe the occasion as advised by state and local authorities. Meanwhile, the federal government has announced that the senior secondary school certificate examinations, the SSCE, for SS3 students conducted by NECO will start on October the 5th. This was contained in a statement by the spokesperson of the Federal Ministry of Education, Mr. Bem Gung, which gives a comprehensive breakdown of examinations for exit classes. The National Common Entrance Examination, which is a one-day NECO exam for intending applicants into Unity colleges, will run in between the senior secondary certificate examinations that will be on Saturday, October the 17th. Apart from NECO, the National Business and Technical Examinations Board NAPTEP exams will start and hold between September the 21st and October the 15th. Meanwhile, the West African Examinations Council exams for SS3 students, which the federal government had earlier announced will start on August the 17th, will end on November 18th. Moving to the South-South, the governor of Edo State, Governor Obaseki, says his administration will continue to work in sync with the other arms of government in moving the state forward, irrespective of economic challenges presented by the COVID-19 pandemic. The governor also signed into law the revised appropriation of 129.8 billion naira, down from 278 billion naira.
COVID-19 pandemic, which no one predicted, has changed the course of mankind. It has imposed certain challenges which we still do not know how they will change the course of our existence. The financial and economic consequences of COVID-19 is as challenging, if not more challenging, than the public health crisis which it created.
In Yobe State, Muslim faithful say the federal government's directives to shut down international land borders as a result of the COVID-19 pandemic has caused a hike in the prices of rams ahead of the Eid al-Kabir Sallah festival. Investigations by Channels Television at various livestock markets in the state reveal rams of bigger sizes are being sold at between 130 and 150,000 naira, while the smaller ones range in price between 30 and 50,000 naira.
Eid al-Kabir is an Islamic festival to commemorate the obedience of Prophet Ibrahim to follow Allah's command to sacrifice his only son Ismail. And the ram is an important animal during the celebration of the festival. In Yobe State, many believe the COVID-19 pandemic as well as high cost of animal feeds have caused a hike in the prices of ram.
This coffee of COVID-19 has bring high price of the animal. For as of last year, you can buy this ram at the price of 50,000, 55, but now they are calling 70, 80.
The food they eat is more higher now. Per a bag, you get it with nothing less than 2,000 to 3,000, but now it's more than that. So the people that are keeping it at home, they spend much on it. So that is why the price is a little bit higher now.
Others believe absence of animals coming from the neighboring Niger, Cameroon and Chad republics were the responsible factor. Presently, borders have been shut. The animals are costly because businessmen from Cameroon, Chad and Niger republics are not forthcoming to our markets as a result of COVID-19. While the situation has forced many to go for fowls as alternative means for the festival, an Islamic cleric explained that the ram sacrifice is compulsory to only those who can afford.
Those who don't have the means, it is even for them to receive the meat that has been slaughtered. Because when the meat is slaughtered, it is to be divided into three, ideally. One part to be kept at home to be eaten, the other part to be kept for future use, and the other one to be given to the poor and the needy. That God do not put any burden on anybody unless what he can bear.
Many are anticipating that when the ban on international borders are lifted, prices of the animals will become cheaper.
From Yobe to Katsina State, where residents say in spite of the current COVID-19 pandemic, they're still fully prepared for the Eid al-Kabir Sallah celebrations coming up on Friday. They have predicted possible poor preparations amongst most people vis-a-vis the COVID-19 safety protocols in courtesy of the fact that most people in the state have not been receiving the needed intervention from authorities concerned to ensure strict adherence. According to them, most people are in a critical economic stress to even purchase a 200 naira face mask.
My Adua border market, located in Katsina North. Here people are busy struggling to get money to buy the festival essentials, the ram. One major complaint by the buyers is the high price this year compared to the last year. The price of an average ram at the Mayadua border market starts from 25,000 naira to 330,000 naira. The buyers are asking the government to help solve this annual problem.
The ram we bought like 50 that time. It is now 100. Okay, last week we came here. The ram we bought like 80,000 naira. Now it's 150. So you keep on wondering, one way interval, and you keep on wondering, this thing, are we buying it with dollars or we are buying it with naira? Because and we produce this product here in Nigeria. It's not that we are bringing it. It's only our neighbor Nigeria that bring it down here. And you know the exchange of SEFA with Nigerian currency, the difference is like in 300,000. It's like 30,000 naira different. So I think the government needs to try to help out people because people are going to do Salah. Where is the money?
Most of those that are bringing rams from Niger, you know, here is very close to Niger. So maybe the insecurity cannot be able to allow them down to Nigeria here. And the exchange rate, again, affected the situation. The exchange rate is high. Yes.
A chief imam in one of Katsina's Jamaat mosques speaks on the level of preparations for Salah vis-a-vis the strict adherence to the safety protocol.
Any Juma at all, we are raising the alarm on please better know that there is coronavirus and what the people are saying about coronavirus is true. Therefore, prepare yourself on covering yourself in any rubbish attack.
As usual, after performing the 2 Rakat Eid al-Kabir prayer and the ritual sacrifice, people would normally come out and watch the historic Durbar, otherwise called a Ogun Sallah. With the advent of banditry and the coronavirus, the Katsina Emirate Council has announced the cancellation of the 2020 Eid al-Kabir Durbar Festival. The cancellation is in recognition of the lingering security challenges resulting in the loss of lives and the property of citizens along with the COVID-19 pandemic. The announcement was contained in a statement released by the Secretary to the State Emirate Council, Bello Maman Ifo.
And ahead of the Salah, the Kaduna-Abuja train service resumed passenger operations today, nearly 4 months after services were stopped due to the nationwide COVID-19 lockdown. The railway opened bookings for passenger services this morning with 4 coaches connecting Kaduna to Abuja. Railway health officials at the Regasa train station told our correspondent that coaches and the premises have been decontaminated before resumption of passenger service. In line with social distancing guidelines, the number of passengers per coach has also been cut by half, while the railway management has made the wearing of face masks and the use of hand sanitizers compulsory.
I want to assure you that according to the NCDC protocols on the prevention and containment of COVID-19, the Regasa railway station have done its best, and we as the professionals have been here since yesterday, standing for 24 hours to ensure that the needful is done. Number one, what we did and they did and we ensured was done was the decontamination of the train on arrival yesterday, the one that left in the morning. And the second one, which we are expecting around 9:15, as soon as the last passenger they embark from the train, it is also going to be decontaminated. And as you can see here, we have provided the footsteps here, as you can see them, for the social distancing, which is one of the among the protocols. Also, the NCDC has told the Federal Ministry of Transport that no traveler will be allowed into the train without wearing his or her face mask, as well as holding a hand sanitizer. That has strictly been adhered, and passengers are here with them. And in the absence of people, let's say, not knowing or getting this information about having to be with their hand sanitizer and face mask, we have made provisions and through the manager of the rail station to get some accredited people he wishes to come here so that they will be stationed somewhere to sell the face mask. And we as professionals, we will inspect such face masks to ensure that they are of quality and that they wouldn't pose harm.
From the north to the south, where in Ogun State, Governor Dapo has tentatively set the 14th of August for the reopening of religious centers across the state, as it has also set 4th of August for the reopening of schools for SS3 students. The governor was speaking while addressing journalists on the update of COVID-19 pandemic in his office in Abeokuta, the capital. While assuring that necessary measures had been put in place to ensure a safe stay by students in their various schools, Mr. Abiodun, however, gave conditions that must be met by religious organizations before the reopening of such centers. The governor also proposed a 6-month jail term for violators of the compulsory wearing of face masks and other COVID-19 protocols in order to bring violators to justice. Meanwhile, the weekend lockdown, as part of the measures to flatten the curve of the pandemic, remains in force. And staying in Ogun State, Salah celebrations this weekend. The Ogun State government has banned all forms of gathering above 20 persons across the state during and after the Eid al-Kabir festive period, asking the Muslim faithful to observe their special prayers in their individual homes. This was communicated by the governor when the new chief imam of Egbaland, Saudola Bangbola, paid a courtesy call on him in his office in Abeokuta. Governor Dapo Abiodun said this became imperative in view of the prevailing circumstances of the COVID-19 pandemic in the state. He appealed to the residents of the state to stay safe by continuing to observe the protocols to stop community spread of the virus.
As a government, we will always provide the ambience for all our people to practice their religious beliefs in a peaceful manner. If not for COVID-19, we would have been preparing for a bigger Ilea celebration. But the pandemic has come, and we pray that God will save us through this trying period. Baba Imam and all the spiritual leaders in the state should also continue to cooperate, support, and pray for us for the successful implementation of our administration's Building Our Future Together agenda. Let me state, therefore, that there will not be any form of Eid prayer or any form of gathering in Ogun State. Therefore, each family will have to observe the Eid prayer at home. We beseech our citizens to stay safe by staying at home. And there will not be any festivities or any gathering that violate the COVID-19 protocols of no more than 20 people at a time. We want to thank the entire Muslim Ummah for their thoughtfulness and consent that this year's prayers will be observed privately and solemnly.
In Lagos State, teachers will have to undergo recommended training before schools are reopened. And that's according to the Director General Office of Education Quality Assurance, Abiola Seriki Ayeni, who says all the private as well as public school administrators will be part of the exercise to ensure their readiness for reopening during the COVID-19 pandemic. Mrs. Seriki Ayeni also says the teachers will have access to training via their website, lagoslearnerstogether.com, and she emphasized that only SS3 students will be returning to school to write the West African Senior School Cert examination.
It suffices to say that children are not resuming school, but we've issued these guidelines toward readiness for the reopening of schools. So we know now that reopening in Lagos State is centered on SS3 class as they try to leave their secondary education behind. This does not mean that all other classes will come back to school yet. So the first step is the issuance of guidelines. That's the first step, and we said that all school owners and school proprietors have access to that. Second would be training. We want to make sure that every single school administrator and a school owner, the management staff, complete a training, and that training will be on our website tomorrow on the 30th of July 2020. When they go to our website, either lagoslearnstogether.com or oeqalagos.com, they will have access to a training video that they will watch and they will have to complete. Upon completion of that training, they will have to complete an assessment that shows that they've passed and that they've learned what they're supposed to have learned within that training. After they do the training, they will now have to create their own plans. So they will create their own individual plans based on the template we give them, or if they want to go above and beyond, they are free to do so. But we are making sure that there are templates issued for learning plans, for distance learning plans, blended learning plans, health and safety protocols, okay? So the schools actually need to do the heavy lifting on this.
We'll take a break on our COVID-19 update at this hour. When we come back, we'll be discussing something that is germane to the COVID-19 pandemic at this time. Please stay on with us. Welcome back to our COVID-19 update. Nigeria, like the rest of the world, is racing towards the containment of the highly infectious COVID-19 virus, which has so far been confirmed in over 16.8 million people globally. Pharmaceutical and non-pharmaceutical safety measures have been employed in the fight against COVID-19. The Presidential Task Force on COVID-19 in Nigeria has been coordinating the national response, with states and local government also doing their bits. But how much of enforcement, especially at the community level, exists? What more strategies need to be employed in order to stem the daily rising numbers? A public health physician, Dr. Tony Adeyemi, joins us on the show via Skype from the Magodo area of Lagos. Dr. Adeyemi, thank you for your time. Welcome to the program.
Thank you for having me. It's glad to be here today.
The issue of enforcement, there's been a lot of back and forth over the issue of enforcement. So many people have shied away from enforcement because they say this is something that people have to own. But it's going on more than 5 months now since we started with COVID-19, and still the level of compliance with the safety protocols is very, very low. Do you think that there is the possibility that community enforcement could give us a better result than we have presently?
Oh, yes, most certainly. Community enforcement could actually be a way to go. Let's remember that a lot of awareness has actually gone on. To have behavioral change, it goes beyond awareness, because when the Nigerian Orientation Agency conducted, it was discovered that over 90% of Nigerians are actually aware of what to do. But the issue is calling the actually a way to go, because you can come around with the community members, the heads of the various forms, and come up with sanction measures. Collaboration is key. You need to collaborate with key people in the community. For example, you can have the neighborhood watch. We have environmental health officers at the local government level. So these environmental health officers are also part of the community. They can go day to day, inspect some of those places where physical distancing is meant to be kept to, some of those places where restaurants are not supposed to have seating, places that are supposed to have hand washing facilities, so they can work at the community level to ensure that people are complying. And then if they do not comply, there should be local measures in which punitive measures that have been agreed by the community for erring community members can now be effected before it's now escalated to maybe law enforcement agencies, or if perchance violence, something like that.
Just this evening, we heard that Governor Dapo Abiodun is recommending a 6-month jail term for those who breach the COVID-19 protocols. Again, another process, another way of institutionalizing the enforcement of COVID-19. Because definitely at this point now, it is no longer about people being aware. It is obvious that there are a lot of people who are aware. Most people are aware. They're just not interested in complying.
I think the 6 months is a bit stiff, because when you're trying to encourage behavioral change, you do not come down so hard with the threats or punishment, because what you would have is people, they do not understand why they are doing what they are doing, but to avoid the jail term, they come up with sharp practices or other ways to make it appear as if they are abiding by the rules and regulations. But let's not always forget our ultimate aim and our ultimate goal. Our ultimate aim is to actually reduce the spread of COVID-19 transmission in Nigeria. And we want to ensure that everybody is carried along, everybody understands the implication. And when you now have effective risk communication is when you are able to get the people on your side. What this means is they understand the situation on ground, they understand the implication of not abiding by some of these measures, and they are able to make an informed decision that I want to protect myself, I want to protect my loved ones, therefore I would abide by these measures. But by the time you bring the threats into it, it sort of makes them, it defeats the purpose. So I think that 6 months jail sentence, it's a bit losing the plot in a certain way.
It brings us to something else, which is the other side of this, which is that if we want to know, if we want to slow the extent of the spread, we must know what we're dealing with. And that brings up the issue of testing. Earlier on in the day, there were the reports that Nigeria has the capacity now to test 4,000, to make, to bring out 4,000 test results on a day-to-day capacity from all the labs that have been set up. But yet, many of those labs are empty. People are not showing up for the tests. And because we know this to be something that could be, you could be asymptomatic or pre-symptomatic, the fact that you don't show signs doesn't mean you don't have it. But in the meantime, you continue to spread it.
Yeah, so another thing we're battling with also is the stigma. Stigma has always been mentioned right from the beginning of the pandemic. Fine, we had a few people coming out to talk about their experiences and by the fact that they are testing positive. We also had highly influential people like governors and all coming out to also state their positive or negative status. But for the layman and the man on the street, who, because we also have cases where people came out and said they were positive, they probably lost their job, lost their home. So stigma is very, very rampant. So a lot of people would not want to come for testing, despite the fact that even those that have mild symptoms or those that are recommended to go for testing do not want to go for testing. But now that we've increased our testing capacity, our risk communication message has to also change. You know, the messaging keep changing and things either improve or get better. So, excuse me, so now that we have increased lab capacity, we can now go forward and have jingles and encourage people to get tested, encourage people to know their COVID status so that they don't go about spreading it. So it's also part of risk communication. Let them know the benefits of testing, because if you are asymptomatic and you have COVID, you can actually transmit to other people around you and vulnerable people in your family. So risk communication messages have to go out to emphasize that you cannot go and test, because initially testing was reserved for a particular set of people. So you need to meet a risk criteria before you can be tested. But now that the capacity has been increased, a new message now has to go out to encourage people to come for testing.
Dr. Tony Adeyemi, thank you so much for your time this evening on the program. It's been a pleasure having you with us.
Thank you so much for having me.
With 624 new confirmed cases and 8 deaths recorded within the last 24 hours in Nigeria, the total number of confirmed COVID-19 cases in the country is now 41,804. while the total number of fatalities stands at 868. The 624 new cases are reported from 18 states, with Lagos having 212 cases, Oyo 69, Niger 49, Kano and Osun each having 37. The FCT has 35, Plateau 34, Gombe 33, and Edo 28. Others are Enugu with 28 cases, Ebonyi with 17, Delta 10, Katsina 9, Ogun 8, Rivers 7, Ondo 5, Kaduna 4, and Nasarawa 2. Within the same period, 561 people were discharged in 18 states, bringing the total number of recoveries to 18,764. Edo leads the pack of states that have discharged COVID-19 patients within the last 24 hours, with 150 people leaving the various isolation centers. Nasarawa follows with 110, Ondo has 100, Delta 39, Lagos 25, Kaduna 23, Kano 23, Plateau 23, and Ebonyi 16. Ogun State in the nation's southwest region discharged 14 people, the FCT 13, Katsina 8, Osun 6, Rivers 4, Bauchi and Borno 2, as well as Oyo and Imo discharged 1. Nigeria currently has 22,172 active COVID-19 cases. Let's expand the conversation on the community-based strategies, particularly enforcement towards tackling COVID-19. Joining us via Skype is another public health physician, this time from the Awoyaya area of Lagos, Dr. Anire Chima Oduko. Thank you so much for your time. Welcome to the program.
Thank you for having me.
The issue of enforcement, the previous speaker on the program did say that there needs to be some sort of balance between the threat of sanctions and getting people to comply willingly. Do you think that enough time has passed for people to go beyond being aware now and for enforcement to be wrapped up?
Yes, enough time has passed. A lot of people are aware. However, I think the problem lies in not mobilizing people's involvement well enough. I think the approach has been a top-down approach. We need to make it a bottom-up approach whereby the community is engaged. We target key populations, key members of the community, like transport workers, market women, even the youths. Engage them, tell them about this problem. They already know, but I also think that a lot of people do not think it is a very serious condition. So I overheard some youth saying, even if they have it, well, they're not going to die. It's not, they can have it. And so we need to let them know it is serious, that even if they might not be that vulnerable, they might pass on the disease to someone and it could kill the person. And beyond using things like a prison threat, we need to also motivate people. So it's not only about using sanctions, it's about motivating them with things that have their interest. For example, I believe economic gain is something that will motivate a lot of people. So if already a lot of businesses are complaining that due to the COVID pandemic, their income has reduced dramatically. So we can also use finance or economic gain as a means of motivating people that until we can clear this virus completely, our economic income, whatever we get, cannot be as it was before. Training the youth, getting them involved, giving them incentives for complying to recommended policies can also go a long way.
Now, we're seeing the numbers go up every day, 400, 500, 600, depending on the day. But these numbers are dependent on the number of tests that we've been doing.
Yeah.
Now, those who have spoken on this program before today had said that we needed to ramp up testing. The capacity is now there, but people are just not showing up. Dr. Adeyemi, who spoke before you, talked about stigmatization. But if we don't test, then we won't know what we're dealing with, will we?
Yeah, yes. We won't. No, we won't. We need to encourage people to come for testing. We need to reiterate the symptoms and the signs of the disease. And like I said, engage them more so that they see a need to come forward. Because I think even though people are aware, they don't think it's that serious a disease. So even if they have it, they might not want to come forward. So we just need to do more education.
But the other side of this is what public health physicians like yourself had said before, which is that what makes this condition really difficult is not really the fact that some people are vulnerable and others are not, but the fact that you could be carrying it and exhibit no symptoms whatsoever. You could be asymptomatic, exactly. You could be pre-symptomatic. And in the meantime, while you are being identified as that, you continue to spread it. You act like a vector. You're spreading it all over the place.
Exactly. And that is why, and I think most of the people that fall into this category are youths. So youths who are apparently healthy and can withstand the virus may be asymptomatic but are spreading it. And that's why we need to communicate more with youth, young people, and also tell them that it's not just about you not coming down with symptoms, it's about you being able to spread it to someone whom it can be a fatal disease for. So we don't need to give up right now. We have to continue communicating and using gatekeepers in our communication. So we want to know people that are influential in the society, like ballets, the head of youth organizations, transport workers. Talk to those people, find out how they think, what could catch their attention, what could motivate them, and work with that. They could say, okay, we want a training. Just look for incentives to draw them in and carry it as part of their own projects. So they have a buy-in, and it's not just something the government is telling them to do. It's something they see the need for and are motivated to do to reduce the spread.
The other thing is that quite a number of people, maybe because of the stigma that was mentioned earlier on, even when they find out that they have COVID-19, they've not gone into isolation, into the isolation centers set up by government. They prefer to treat themselves. They prefer to treat themselves at home. And social media is awash with all kinds of medications which are supposed to help with this, including hydroxychloroquine. There was a video over the last 24 to 48 hours talking about a cocktail of medications that could cure COVID-19. What would you say about this?
Well, you can't. People like to. The truth is, it's part of our culture. People like to. If we look at Ebola, the Ebola period where people were taking salt, people like to look for cures and ailments, and they like to delay going to the hospital until it's very bad or it becomes fatal. So it's still education, communication, and them thinking, knowing that they'll get the best of care if they go to the isolation centers. So we need to educate them. We need to talk to them about this and continue our communication efforts.
Thank you so very much, Dr. Anera Chima Odugo, for your time this evening. It's a pleasure to have had your perspective. Thank you so much.
Thank you. Yeah.
Outside our shores, travel bosses in the United Kingdom have urged Prime Minister Boris Johnson to replace blanket quarantine measures on countries with regional travel corridors as they warned the sector risks being permanently scarred. It comes as Transport Secretary Grant Shapps arrived back in the country to begin his own 14-day quarantine after a holiday in Spain. He said he is, quote, desperately sorry to those who have lost their holidays, but that the measures were essential. Our correspondent in London, Juliana Olainka, now tells us more.
Book a summer holiday at your own risk. That appears to be the message for British holidaymakers following the surprise move by the government to quarantine arrivals from Spain over the weekend. The drastic decision has created lots of uncertainty.
It's unbelievable. There's no need for it at all. No need. I mean, I think you've got the safest bit over here. You started way before us in the lockdown than the UK did, you know what I mean? So it's unbelievable.
The decision has dealt a major blow to a tourist season already hanging by a thread. Last year, Britons made up over a fifth of foreign visitors to Spain. Some airlines are already cancelling flights. Heathrow bosses, keen to reduce the effects of this new quarantine policy on the travel industry, is urging the government to adopt alternative measures to self-isolation. Testing as an alternative to quarantine.
We are calling for a double test of once on arrival and the second after 5 days or 8 days, of where people would stay in quarantine until they had had two tests that showed that they didn't have the disease, and then they would be allowed out earlier than would otherwise be the case. And we need to work with the government to make this work.
Since ending its nationwide lockdown a month ago, Spain has been grappling with a rapid proliferation of new cases. The Health Ministry reported over 6,000 new cases over the weekend and said it was monitoring over 300 clusters around the country. Britain do not want to see this increase imported into its shores.
We took the decision as swiftly as we could, and look, we can't make apologies for doing so. We must be able to take swift, decisive action, particularly in relation to localised or internationally in relation to Spain, a particular country, where we see we must take action. Otherwise, we risk reinfection into the UK, potentially a second wave here, and then another lockdown.
With a death toll currently standing above 45,000 and talks of a second wave of infections, the government are prepared to do whatever it takes to avoid a repeat of the last couple of months, even if that means ruining summer holidays. Juliana Olayinka, reporting for Channels TV News in London.
Let's talk to Juliana now, who is in the British capital, from where she joins us via Skype. Hi, Juliana. Nice to see you. Trust you're keeping safe.
I'm keeping very well, thank you. I haven't decided to book a holiday to Spain, so I'm fine, thank you, Laddie.
It does look unfair, doesn't it? The Transport Secretary has just returned from holiday, and now he's put a stop to everybody else's holiday.
Well, yes and no. I started off my report by saying take a summer holiday at your own risk, and that appears to be the case now. 600,000 British tourists have been caught up in what some have described as a shocking announcement by the British government on Saturday morning after hearing reports that the cases in Spain were rising. Of course, you can imagine after being locked up for 4 months, Brits were really looking forward to having a sun-kissed holiday on the beach, and they decided to do so. You know, they listened to the advice that was given by the British government at the time, including the Transport Secretary Grant Shapps and the Health Secretary Matt Hancock, by saying that you could travel to these places. There were over 50 destinations put on that list, which meant if you were coming back from certain places across the world, you wouldn't face quarantine. But alas, spikes have increased, and there are major concerns, I've got to tell you, here in the global north, that a second spike of infections is on its way, and the Prime Minister Boris Johnson just cannot risk that. We have been one of the worst affected nations in the world, and like Dominic Raab, the Foreign Secretary, said in my report, I believe the British government may have been criticised if they didn't do this last-minute stop, and floods of Brits came back to the country with COVID.
The other thing, of course, is that those cases that you're talking about, they have risen 14% in just a week. So this is not some theoretical prediction. This is actually happening. So there is the possibility that you would have a second wave.
Absolutely. It depends on who you speak to, Laddie. You know, there are some scientists that have been speaking on British media, and they say it isn't a second wave. It's basically the first wave that hasn't been eradicated. And we all know that the pandemic can only go once a vaccine is on its way. There are several that are being cooked up at the moment, but none that are successful thus far. And it's really with the easing of the lockdown, governments across the world saw just how crippling these lockdowns were, and they had to ease them, particularly Britain. The OECD has said that Britain will be one of the worst nations economically hit by COVID. So once you began allowing people to step out, once you began allowing these travel corridors, there was always a risk that infections would be on the rise. And we are seeing that not just in Britain. You mentioned the 14% surge over the past week or so. We're seeing a serious increase in places like Hong Kong and Thailand. Both of them thus far are still on the no quarantine list. And we're seeing a rise of infections in Germany and, of course, Spain. And there are some suggestions that even France, our closest European neighbour, besides Ireland, could perhaps go on that quarantine ban list. But, of course, that will be an extra blow to the already crippled tourism industry.
Indeed, it would be. Thank you so much, Juliana, for that update today. And please do continue to stay safe in the midst of all of this. Thank you so much, Juliana.
Thank you.
The annual Hajj pilgrimage performed by Muslims from around the world has begun in Saudi Arabia. But this year's religious event is dramatically scaled back owing to COVID-19. International visitors have, however, been banned from making the journey to Mecca in order to further curb the pandemic. Only 10,000 pilgrims are expected, as opposed to about 2 million usually. The vast majority normally come from abroad, but this year the only foreigners allowed to attend are those who reside in the kingdom.
Dr. Anthony Fauci has blamed the recent surge in cases on some states not following expert advice, adding that the height of a pandemic is not a time to be distracted by political infighting. Muslim worshippers began the annual Hajj pilgrimage today, and the event has been dramatically scaled back due to the COVID-19 pandemic. Amidst efforts to curb COVID-19, Muslims from abroad will not be able to attend the pilgrimage. Typically, some 2.5 million Muslims visit the holiest sites of Islam in Mecca and Medina for the week-long pilgrimage. The Olympics and Paralympics will be held in front of a limited number of spectators, according to the chief executive of the Tokyo 2020 Games. Toshiru Muto says the organizers are hoping to allow what he calls a limited number of spectators with full consideration of social distancing into the venue.
It is rather difficult for us to expect that the coronavirus pandemic is contained. But if we can deliver the Tokyo Games and Paralympics, I think it will become a role model for the next Olympic Games and other international events.
During the online meeting with Putin, Russia's deputy prime minister said the country's first potential COVID-19 vaccine will gain local regulatory approval in August. The production of the vaccine developed by Gamaleya Center will begin in September. More than 100 possible vaccines are being developed around the world to try to stop the COVID-19 pandemic. At least 4 are in final phase 3 human trials, according to WHO data, including 3 developed in China and another in Britain.
You can also take a closer look at some of the COVID-19 global numbers in real time by logging onto our website, channelstv.com. You will get more updates and better understanding of all you need to do to stay safe and alive. You also get the figures on some of the very important stories, such as India's reopening further in spite of cases there reaching 1.5 million. You also read about recoveries in Nigeria, Africa, and around the world. That's apart from the fact that you can find the latest stories, including the details of the extended phase 2 ease of lockdown. Thank you for watching. I am Ladi Akiridoluale. Good night.